Breathe in. Out. Yes, at them. Ayo, yes, at them.
Okay, so now let's come to
Yes, at them.
the sixth and the seventh target. I'm combining both together. That is yam and cassava.
Yes, at them.
Yam and cassava is good. They are very good. You can consume them every blessed day, but I want you to beware that they are high in starch. And when you consume and they digest and they break down, the sugar level is 100%. That is why you are always supposed to blend plantain when you are consuming yam and cassava. Do not use only cassava for fufu in preparing fufu. Don't use only yam in preparing fufu. Other than that, when they break down, the sugar level is 100%. If you consume plantain and the plantain breaks down, the sugar level is about 10%. Oat and wheat is about 15%. Plain rice is about 60%. Brown rice is about 40%. Cocoyam is about 70%. When it comes to yam and cassava, 100%. Nti mo a motade baele ene banche eye fufu a monfa brode enka ho no. Baye ne banche no se wudi wie na enyam a ehikire no e wo soro pa. Eni nti na wo se wudi fufu a oma brode no edoso. Wodi banche ne baye eye fufu a ma brode ko. Se de be ya wudi wie na enyam a ehikire no wo ehikire level no e be bafo. Na se obi wo ho no ma endende wenye ehikire yare. We jay a situation, Odi onum cocoa onum tea on for sugar and come. But of course, checking the sugar and was so because Odi banchini by la on fat, brodier and flat, Odi no do be and one would. Tinina, and Yamudia, not a ship, I've done a situation way. You do around the city here if you buy any bunch. Most of the patients nowadays are diabetic as a result of consuming yam and cassava excessively. So when we talk about sugary foods, consider yam and cassava and know when and how to blend them. It is a food you can consume every day if you wish, but know how to blend it properly. Remember, because they are starchy, and I'm saying, amamai womb and more banchene by immunity. Make sure that your stew and your soup they are flavorless, like contemporary or green vegetables. Green leaves and green should be more in your stew or your soup when you are consuming yam and cassava. Okay, so when we talk about sugary, all these ones are part. So when they are chest pains, so first of all, take all these into consideration. For into be on the chest, a sign about quite chest, so when they are chest pains, it's one sign of heart failure. You must see a nearby doctor for early attention. Let's come to the second symptom. The second symptom of heart failure is palpitation. They are just and also extra or say wakoma na one they no air buffalo. And you'll be an akoma, a 10. That's when your heart is beating extremely fast. An example is when a lady is pregnant. When a lady is pregnant, because their child solely depends on their blood to develop, they may be palpitating. It doesn't mean they are sick. It's due to their condition. Yeah, what if you have a wakoma 10 and not just say, we are it. A bini oba wa faithful. Oba wa faithful no ne ba no, ni moja so no gina nyi. Nti na nakoma 10 and not just so yare. Also, when you have just engaged in some physical exercise, jogging, skipping, what have you, and you stop at once, we all know what happens. You may be palpitating, panting here and there. Say, who exercises, who through the car, who ye jumantin idea. So, what is it? Wakuma, who ride a bicycle. This is what come up at 110 and not just all yare, they are all unity. But when you've not been through all these situations, and you always see your heart beating extremely fast, see a nearby practitioner for early attention. That is a sign of heart failure. Unkotibia we na that's what time the others were come airborne 10. That's a nearby doctor not sure. Ni a sign a chest or come on buffalo. Me and body a chest me son. I just come on buffalo. And only a breath limitation. You can call that limited breath or shortness of breath. That is when you have difficulty in breathing. It's also another sign of heart failure. Obi on take a cry on my breath. Or you be big a cry on tenacity. who fear ya bronsign, who first, second, third floor. You feel like sitting down, I was sitting down. You want to go for jogging. Back in the days, you can do a lot of exercise. Nowadays, just after a segment, you are giving up. You wear the face mask for some few minutes, you are exhausted. You are having sex with your partner. Each time reaching your orgasm, breathing is always difficult. So when you na we pa mo di agona, we ya na ahunja ya di amount. Na time bi ara wa fam say normal. That be nearby doctor no show. So when there are shortness of breath, it is not normal. You must see a practitioner for early attention. Now let's come to the fourth symptom, that is hypertension. Hypertension. There a torso 9 I no so chest our come na ho den air koko. BP. Some BP the amu na amu nim. Aha, or yare bia wa gidi pa. Uko fie bia mu a BP akwa se menopause. A gidi basa. Obia ya BP. From BP very popular. It can cause glaucoma, which is blindness. And the symptoms are that nowadays you want to read, and when the paper is closer, rather you can't see the letters. You see the letters blurred until you try bringing the paper a bit far before you can see the letters. You are on your phone. You feel like bringing the phone a bit far before you see the letters. You have to be checking your BP often and see a practitioner for early attention and know when and how you prepare a nutritional guide for yourself. A statifi baby, BP need to be cause glaucoma, any nifla. Any flyer. Na sa wo pese wo science na ebi ni say wo pese wo kenkan o Bible ana wo kenkan book. Na paper no ehoma no e wo nim say ya wo ni ye eni wo ya wo ya wo letters ni ya je wo dia bechi ansa wo hu. Ene ya sign ba kwa say wo check wo BP time bia na wo doctor no ma wo cheche. Ene ya sign ba ko. The same BP can also cause kidney failure. BP na so ebetumi ama ye kidney no asai. Na sign ba ko ne say utiem obowa ana say osele a na wote yaw na wo mfi echi ha say baby a kidney no wote yaw. Say first time ko ye kidney test na mo BP na ye me cause. And any idea so the same BP can cause kidney failure, that is chronic kidney disease. And the symptoms are that nowadays, anytime you shout, you cough or you laugh, you experience severe sharp pain at the lower rib where the kidney is located. First time you must go for a kidney test and BP is the cause. The same BP can cause swelling on the foot, and the swelling is associated with a change of skin color. For instance, you are fair in complexion, there is swelling at your foot, and that spot, the skin color looks green. You must go for a kidney test, and BP can be the cause. When you are dark in complexion, you see the spot with thick black associated with the swelling. The same BP can cause stroke and heart failure. We did an assessment, and based on our assessment, 60% of our hypertensive patients were men of God, teachers and official workers. We all know the work of men of God. They stand and preach, they do counseling. People see them one-on-one. When your congregation is large, they get emotional. Let's come to teachers. Teachers stand and teach. Because they have to explain a lot of things, they talk a lot. Anyone who talks a lot, spit a lot. So they short a lot of body fluid. And imagine teaching whilst the student is talking at the same time. It's instinctive, so they have to react for the student to keep quiet. Aside eating, they mark, they prepare lesson notes. It's a brain-consuming work more than a steel bender working in the sun. So every 6 hours, they shot some holes of blood. So, your group beer, one time a software. Officers. When you say software, Emu tentiem bomb pie kikem preaching mu yeso bia peso mu sofo e ka ne program kire ade kirefo onso mo ta agina ho na o ma kire ade enam say wo say omutumi e kire ade ni na nkwala ne ti ase ni ti o mo kasa bebre obi o kasa bebre bia so tunto si o bebre sa so na sofo so tentiem omu tentiem sa na teacher for so tentiem to omu tunto si o bebre obi o tunto si o bebre mu si ata a short term. Now, she said, "What chila de na kalaso kasa at the same time." And Momubu Fujo Mutim Colano so more man too. Now, apart from said, or bachelor dear no some market or prepare lesson notes. Enti a idea it will be action one day more than still bend away a juma with us. 6 hours be a teacher for a shortest or most of blood. Official workers, it is assumed that 5 times a week they are always on sedentary position on their chair, engaging with customers, reading, writing on the monitor. It's also a brain-consuming work more than a steel bender working in the sun. Consider a banker. Consider a Senate officer. Among others. So that is why when you know you have been on sedentary position for more than 3, 4, 5 hours, you must stand up for about 5 minutes and sit down again. Don't sit continuously like that. I hope you are getting my point. Yes. So what matters now is life after 60. Like I told you, the kind of life you live now can tell after 60 what can happen to you. And BP is one of them. BP is a life-threatening disease. There are minor causes of BP. We see them to be normal, but they are not. You understand? Chronic kidney disease, like I told you, is one of them. I won't talk about it. I've already explained that earlier on. But these ones, they can cause high BP, but we see them to be normal. You want your man to be a year when they say, and ya dear, so no can my BP cause of the first cause of BP is mental stress. Stress in general, but the most dangerous one is mental stress. Yes. Adia ba ko edi nkanya ebetumi ama obi pia koso pa ene se obe stress wa adwen. So yes, that is one thing we must check. One is excessive thinking. You overthink, thinking by heart. Obi odwen broso odwen amane broso. O stress wa adwen no. What I say? Now, let me give you a typical example of mental stress. Pressure. When you are under pressure, is one typical example of mental stress. Let me give you a typical example of being under pressure. You have just received a phone call. The moment you pick, it is your sibling or your best friend demanding for 200 cedis, telling you it's an emergency. And looking from the way the person is explaining, you are much affected, so you promise, okay, give me some time, I will send. And because you promise, within 30 minutes, the person is calling like 20 times for that money. That alone is an example of mental stress. Into a beer or time man or pressure. Maybe Peter Cosso. My main mouth and fatten back. Say when you call. Now when you call, I wouldn't be an hour down to be our penance and pana or catch your say of the 200 cities. Now or catch your say, or the year yes is here. Now, can you offer so kind into account? Our promises okay, Matty. What can we send? Now, promising anything. Don't show be see and I say, and you know, Nippon Flebe 20 times if it's kind of black. And only an example, in fact, a year under pressure. So, there is a stress hormone in the brain called cortisol. The cortisol prepares you towards every emergency. It's a stress hormone. The cortisol is a stress hormone. It prepares you towards every emergency. So that call that just came from your friend. Let's assume that your friend is called, let's say, John. You know, John is a popular name. John Rambo. You understand? And Schwarzenegger in Commando, he's John. So John is a popular name. When you use John, yeah. Let's say the one in need of the money is John. That call that came from John demanding for 200 cedis is now an emergency to your cortisol. So anytime you receive a call and you pick and you see it's John and the 200 cedis you promise is not ready, the cortisol will quickly cause your heart to beat fast and open your breathing rate and quickly make you calm for you to cope. But normally, most of us, when we promise to send somebody and the promise is not ready, normally when they call, we don't pick, just to signal them the money is not ready. But sometimes The receiver also thinks, looking from the way things are going, they have to keep calling before you send. So they will keep calling. Apparently, your cortisol will start communicating with you. It will be telling you, my friend, pick the call. It is disturbing me. Pick. That is when your friend can just greet you and you might not mind the person. Not that you are plugged with the person, but currently there is general internal meeting within you. That is why you are not minding the person. So, until the person me chair say, "O promising in Pacono, say Obama is coming. Oh, about 10 minutes, not 20 times." An only example of mental stress. Now you move to do say, "O promise you be some best sending this car." Now say promise me you ready no flat. Esa o picking up say you ready won fa. Won fa na nipa no koso a friend. Esa o stress o mo na your friend cortisol. Ni bufu. Na ni bufu o start say o no wo nipa na akasa. O ka cha say o wan pick call na disturb me pick. E hono no obi chia kra won fi no. Esa o ni nipa no nya ntoko a ba bi e koso. Ewo meeting dey cause until na ma on picture. Enti normally no so be who promise so be na nipa na fa na promise ni ready. Esa o pick. Ben ka say enye ready to won fa. Esa o cortisol no stress wo mo no. Ono so ni bufu na ni bufu a ono so betumi wa time bia no omo wa come aboard tente. Wo hu ko na wo fiti omo wa come aboard tente. So the first step to take is that the moment you observe the first caller, John, keep calling for the money. You pick and say, John. In fact, I promise, but the money is still not ready, so you stop calling. The moment I get the money, I will send. The moment John stops calling you, there you are managing stress. That's what we call stress management. So apply this one to all the other forms of stresses. Don't pile them up. Into a nipa no airflow na won pick no e bia sika na pressure the money ready to won pick it or more pressure one water pressure amount esa obi pi betumi akoso nti e ba na sa pick na ka say John me na me say no but sika ni ready to dey jai frɛ ready am the best send. The moment John be jai frɛ na che say who manage stress who manage one who control. But as a friend says, stress management. It is school fees, rent, utilities, no one can. And my name will bomb, woman will bomb one I will under pressure, and you'll be the cost. Oh, stress one drink, then there are flow, and there are tile, and there are you see, one away. Sadly, with these things start when there are so many other calls. You are there and you have received an emergency again. This time it's your son in need of money. The same cortisol will cause your heart to beat fast, open your breathing rate. And you are supposed to act, but you'll be sitting down. Then all of a sudden there's another emergency. This time it's your landlord reminding you of your rent. Because there are 3 emergencies and you are not acting, the 4th emergency call that will come. Instead of your cortisol preparing you to then say, I'm tired. There are 3 calls, you are not acting. This 4th one, I can't do anything about it. That is when the person, I hope you are getting my point. Yeah, that is when the person's BP will begin shooting up because it's been too much. So the first step to take is to pick the first caller's call and tell him, please, stop calling. When I'm ready, I will send. Other than that, the person will keep calling and it will give you a mental stress. So that's one typical example. Temperament is also another cause of high BP. When you are quick-tempered, ebufuo, obi aya na nebufu, ano de ya no jina na boso, munja, yenye ni say, ano why na beti say ebufuo. If you look into the family history of patients who are often quick-tempered, they normally don't live long, and even if they do, it's associated to cardiac problems. Try not to be quick-tempered. Avoid planning revenge in your mind. Avoid shouting when you are very angry. So before entering by heart, allow your temper to cool down before you talk. You see, when you plan revenge in your mind, there's another stress hormone called adrenaline. The adrenaline is very tricky. It can support or oppose you. That is the work of the adrenaline. So you see, already you have planned revenge in your mind. But you are not ready for that revenge. But once you are certain, because you have already planned that revenge, the adrenaline will be reminding you, my friend, when I will striking, you are wasting time. You see, your heart may high. Your chance of getting BP is 90%. So don't plan revenge in your mind. So what the show team said, Adia will see me see you will be Yenibia. And the when you're ready, crowd or the boss as stress on one eye, your friend adrenaline, or no, I catch us all wine. The Ben a year quite quiet, and no check. Yes, at time, you are Wakuma, a bebo, Wakuma boy, Wakuma to 2 or 4 will be the cost. Into a video, be a fashion and find show team say, do not plan revenge in your mind. If somebody bites you, do not bite back. But you can choose not to avail yourself for the person to bite again because it's painful. Obika and Kanibi. But I am burning money in Kaudium if you say yeah. And life is too precious. So do not go around making peace with people who are not willing to make peace with you. You end up getting BP for nothing. And Chinchin said one man, or money when you have to come, only on Mukobo, Wabro, Madin, or my Madin said, and you have your money to go. Yes, and the Subania BP. Only Pana, why not just where they are, or no back on, no, and wow, how daddy. Do not go around making peace with people who are not willing to make peace with you. You end up getting BP for nothing. You can rather free your mind, forgive them, and make peace with them at a distance. Over to me, I do my will be out there, chum. Now, we make sure say, even though who are there, Naso, only a mountain as on the before ni film na MY. Sunyakasa 9, learn 4 words. Sunyakasa 9. These 4 words, they stabilize the condition and the state of the heart. They don't cause the heart to high. Sakasa 9 we have wama wakuma no ebojono. Ema wakuma ntutu rough. Ema ubi full rough. These 4 words are sorry, thank you, forgive me, and please. Me pacho, me dase, facha me, enka. Learn these 4 words by heart. Sunyasakasa 9 way. For the sake of your heart, enam wakumanti sunyasakasa way. For the sake of your heart, enam wakumanti sunyakasa way. Learn these 4 words for the sake of your heart. It always stabilizes and maintains the condition and the state of the heart. Then finally, practice your cardio exercise. Now I am going to perform the cardio exercise. It's an exercise of the heart. When you have difficulty in breathing, when you are an asthmatic, even when your temper shoots up, and you apply this exercise, it will just calm your heart at once. When you have an attack, you can practice it. So now we are going to try it. So the first step, you fold the arms this way. We are using our toes, our mouth and nose. So when I ask you to breathe in, just inflating oxygen only through the nose and stand on the toes like this. And when I ask you to breathe out, deflate all the carbon dioxide only through the mouth. Then you come back to the normal position. I want to see you breathing in through the nose and standing on the toes and breathing out through the mouth with much pressure. So now we are going to try it. So now, the final segment, we are going to practice the cardio exercise. It's an exercise of the heart. When you have difficulty in breathing, when you have an attack, even when your temper shoots up, or you are asthmatic, it will just calm you down at once. Among all the exercises, the cardio exercise comes up first. And it's simply inflating in oxygen through the nose and deflating our carbon dioxide through the mouth, like this. It's very simple. Not even jogging is better than this. Not even the machines I use in my facilities is better than this. And there are 6 segments of cardio exercise, and I'm going to demonstrate it right now. If you know you have breath limitation, you have difficulty in breathing, you are asthmatic, you have an inflammation of the upper respiratory tract, you have nasal congestion, try it with me right now. First of all, if you are hypertensive, severe hypertension, moderate hypertension, mild hypertension, try this one. Even if you are hypotensive, try it. Okay, we are just going to inflate in oxygen only through the nose and stand on the toes like this. Then you deflate our carbon dioxide through the mouth. Then you come back to the normal position. So we are going to try it. So this is the first step. You breathe in and out. Then the second step, you hold the back of the neck like this. You breathe in and out. Then the third step, you make a first step. You breathe in and out. You do this first three to prepare the heart before you do the other three. That means you can't just get up and exercise the heart. So right now, that same adrenaline has quickly signaled the heart, my friend, they are trying to exercise. They have said, I'm aware, it's like the heart is aware. Now, we are going to do counting. It simply means now when you breathe in, hold on your breath. Let me finish counting before you breathe out. Until wow, BP was so wow, we attack at once, and I will go through we at once, but before the theater at once. Your friend of cardio exercise. To be was so far, General Misia, and dear the Mawa, Yay, now, it's when I am near first, near some 3 hours. We are near some way out of prepare what woman, as a wire 3 hours, the Bayachi. It is here, a toss of form, they are toss of form. What was right episode chest? Now the left one about bench. So the fourth step. You put the right hand on the chest and the left hand on the back of the neck. And we are going to go through the same procedure. The air first and one air second. So you breathe in through the nose. Then this time you do counting. See how you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Out. So we are going to make 25 for the first step. When you are in the house, you can start from 25. But even when things are difficult, when you start from 10, the next day the body itself will be 20. So when you be now at 10, the next day you person I did channel person your body now the power sign I can 15 then you change your hands. Now what's the sound? I'm listening to the way my heart is beating in me and counting accordingly. That's what you must do at home. And if you want to figure that out, concentrate on the hand on the chest or the back of the neck. You feel it within you. You can't accordingly. No person who the way I come and go. You need to go. I drink to what's that? And that will go around quench. No better to no no no. No be able to make exercise well for so. Any of here or you of you are seven. Now over try no be here 7 feet. Any of here on for shade motion. On fire and shade motion. We decide money now through me. Now I give me a hand and the one hand now we exercise with your business on. The only individual who can benefit from this exercise is somebody who has any issue in the mind and try to confront that issue in the mind. A peaceful mind is the way it is. Don't be apologized with people. Try and forgive everybody. Make sure that your mind is free. Then you can benefit from this exercise. Avoid keeping sad or painful events with you for a longer period. All these things won't help you when you are practicing this exercise. So now you are going to try the fifth one. So you do the same thing. You bend your head and breathe in and hold your breath. Wait, you know what I'm saying? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Out. And breathing out. My head is short. And I'm saying, in breath. We don't have time. That's why I'm counting 15. In the house, you can count 25, you can count 30. Don't force yourself. You will here and control. We are 10 hours, what you have more than 15. Then we are going to do the last segment. We are ready to start. The last segment, you come down this way to your feet. Then you come up slowly. Whilst you are coming up, you are breathing in through the nose. On your toes, you hold your breath. You do national if you wait, you know, where age is just a number. Come on, if you are a man, and travel to be. But one young year, which means you have a common. I hope you understand. So when you are pregnant, come down to your kneecap, the one we call patella. Do not bypass your kneecap. So now we are going to try it. So when I ask you to breathe in, now you come down slowly. While you are coming up, you are breathing in only through the nose. Keep on breathing in only through the nose. On your toes, you hold your breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. The only individual who can benefit from this last one is somebody who can be able to hold on his or her breath for a very long time. Obi obi to me this situation for so any obi to me jina na no so ache. But when I'm counting and I get to let's say 20 and you are tired, you can breathe out. The next day the heart is for urgent to count 40, 50. You are not the one forcing, it's the heart. I have been timing myself. I started from somewhere. Until obi to me is situation for so any obi to me jina na home so ache. Nti say you kind of 20 na wa bla. Obi to me agye ahome. The next day person ya akoma na bema wa kan 40, 50. Enye wa na won so akoma na ma we. Me to me the time at my so. Now, there are instances when you are developing a cardiac problem, but you don't know. At times, you go on my own, so you don't go for early checkup. Into my own hospital near and so now I am going to demonstrate it again. I'm going to show you how to sense dangers in the heart. It's a message behavior. If I bet you, senior, Ubenya for my area, now I doctor, they are short. So now you can watch with discussion with you. When you come down slowly, so over from here, whilst you are coming up, you are breathing in slowly. You keep on breathing in, when you get to the middle like this, you do feel say, and you want to breathe in and you feel extreme tightness in your heart. But I want to try and breathe in, but you feel severe tightness, which is and you cough, and that stops you from doing it. It's also another sign of heart failure, and also a sign I just said, I'm manager in Jumaya, you don't doctor, you see a doctor for early attention. Once again, if your guess is right, this is your Saturday. Go to my YouTube channel and subscribe and practice the exercise. For YouTube, not for exercise, na sisi akakaya amefanya wuti ni krama jo na hakrama jo wa YouTube na njo kwa na kwa shana mso kakana msako ma ate Mbrah na mfe chome tu kakara.
Welcome to the fitness world where age is just a number. Ayo, yes I them. And if your guess is right, this is yes I them. Come on.